Have you heard about liquid biopsy for cancer? Here's what it is. A liquid biopsy is a term that's given essentially to a test done using liquids from your body, and usually it's referring to blood. You can do two different types of cancer liquid biopsies. One is a discovery or early diagnostic test, and then the other is a treatment monitoring test. For discovery, there are panels out there right now, blood-based panels that look at about 300 genes, known genes associated with cancer problems. So we highly recommend those. There are smaller panels that are like 90 genes. Don't recommend those so much. Go for the 350 gene variety if you're doing it for discovery. There's also a blood-based test that looks at every gene in your body. It's called a liquid RNA test. I highly recommend that. Highly specific, excellent for early detection, can identify if you have cancer even before there's solid tumors present. And then if you've already got a diagnosis of cancer and you're on a targeted therapy and you're wanting to make sure your treatment is working as well as it possibly can, that's when you'd use a liquid biopsy monitoring test. This would be done ideally just before you start your treatment, and then about 3 weeks into your treatment, we can run a blood test and we can identify with extremely high levels of certainty if your treatment is working at all or as well as you'd hoped. It's an excellent test. So you can use liquid biopsy for diagnostic to identify if cancer is present and a little bit more information about what treatments are going to benefit you. And then you can also use it for highly accurate and speedy monitoring of how well your treatment is working.